We really aim to improve care coordination, improve health outcomes, and facilitate research to advance modern medicine, all at the same time while preserving patient self-sovereignty, because for us, that's incredibly important. Hi there, welcome to Medical Channel Asia. My name is Suhina from Jonda Health. Today I will be speaking about data privacy and security in the healthcare industry. I'm actually a physician, a chronic disease warrior, and a former pharma medical director that really has experienced the challenges of health data fragmentation firsthand from different points of view. I've not only lost a family member to cancer, but I've also experienced these challenges myself. So I myself am a patient, and I have a number of autoimmune disorders. And so I need to manage my care across multiple different private healthcare providers in Singapore. So yeah, that's me in a nutshell. I think before we even I talk about what Jonda Health is, I think the one thing that people don't really realize is that 30% of the world's data is actually healthcare data, and an individual patient generates about 80 megabytes of data alone in a single year. So that's a lot of data. And as we're starting to see this increased digitization, there's lots of mobile health applications, wearables, medical IoT, and that just means more and more data being generated every single day. And the great thing about this data is that this data can actually be used to identify trends and patterns that can improve our overall health, well-being. It could unlock cures for rare diseases and actually provide evidence for public health policy. So all that sounds really wonderful. Unfortunately, however, even though we have all these wonderful, powerful analytic tools, the biggest challenge is actually leveraging that data and analyzing it. And this is because the access to the data itself is a challenge. And this is because of data silos, lack of interoperability, multiple data standards, and not surprisingly, data privacy regulations. Which is what we're discussing today, is data privacy and data security. Why we created Jonda Health, along with my personal frustrations with health data issues, Jonda Health was really created with the vision to really unlock the power of real-world health data to not only improve health outcomes and advance medicine with privacy and security by default, but also preserving self-sovereignty, because for us that's incredibly important, that we actually protect individuals' data. So how does Jonda Health do this? So we do this actually by standardizing such health data and making the sharing and using of the data more transparent, secure, and accessible. And so what we're looking to do is we're aiming to build a distributed collaborative network together with data transformation, consent, and data standardization AIs secured by zero-knowledge encryption. Data privacy in healthcare is critical for a number of different reasons. So first and foremost, keeping a patient's information secure and confidential really helps to build trust, which really benefits the health system as a whole. Maintaining privacy also helps protect patients' data from bad actors. And as we know, breaches can, and they do occur. And data breaches affect various entities such as healthcare providers, health insurers, etc. And this can take the form in many different ways. So they could be email hacks, unauthorized disclosure or access to medical records or email. They could be network server hacks, etc., etc. At the end of the day, these bad actors may want access to such patient information for a number of different reasons. And this can include selling that data for a profit on the dark web, or for actually blackmailing the affected individuals. Another important reason for really ensuring data protection is if one of these organizations or entities really suffers from a data breach, this can actually cause operations of that entity to actually pause temporarily. And that can create an issue from a patient perspective, because the pausing of these operations may lead to the patients having a delay in treatment or really actually missing out on the care that they need. One of the biggest challenges when it comes to securing healthcare data is that the cybersecurity awareness in the industry is really trailing when you look at the amount of rapid digitalization that is happening. So I think, healthcare is actually in a really interesting point in time, because it really is at that turning point where there really is this fast adoption of smart technologies to really support the accelerated demand for healthcare services. And so to deliver higher quality of care at a faster pace, hospitals and clinics are moving patient records to the cloud. They're adopting medical IoT devices and other things, right? And the challenge remains is that doctors, nurses, and staff members may actually not have the time or the necessary education to really understand what are the cyber risks involved with using all of these new technologies, right? Because from their perspective, they simply need the devices and the systems to work, right? And so that becomes a challenge. Also, there's a huge rise in the number of digital health applications or mobile applications that are being built. And in a recent report that was actually done, looking at mobile health apps in healthcare and in wellness, what they realized that actually a lot of these apps actually leak sensitive data through APIs. So third-party integrations can be a challenge. On the other side, another big issue that faces healthcare organizations is you may have medical devices or legacy operating systems, and sometimes these legacy systems or outdated medical devices don't really get updated in a timely fashion. And in some cases, when it comes to healthcare providers, if the staff is already familiar with using a particular technology or a system or legacy device, the thought of investing in a new technology and retraining everyone, sometimes seems like a bad idea, but that can potentially open you up to a number of different issues. First and foremost, I think for us, we're actually built with data privacy and security as a core value, and I think that's fundamentally really important. It's so important that it's even in our name. So Jonda actually contains the letters NDA, which stands for non-disclosure agreement. So we do take it incredibly seriously. So for us at Jonda Health, we actually have multiple layers of encryption. So the database is encrypted. The tables that house the data are encrypted, and then the data itself is encrypted. And then for the data level encryption, we use something called zero knowledge encryption. So this is an encryption process where the user's data is secured at all times, with only the user having the key needed to actually access and decrypt that data. So a good way to think of this is thinking of a bank vault for which you have the key and the bank doesn't keep a copy, right? So in order to access what's in the bank vault, you need to use your key. In our case, that key is the key to decrypt your files, meaning only you and you alone can read your files. Okay, so encryption on multiple layers. In addition, what we do is we actually have real-time hacking audit. So that actually alerts us on any real-time hack attempts. In addition, we're constantly updating patches when they are released, and we're regularly conducting third-party white box penetration testing And with regards to data privacy, we're compliant with HIPAA, GDPR, and PDPA, and we're also in the process of getting the necessary ISO certifications. So first, let me give you a perspective on the patient side of actually using an application like Jonda before I go into a little bit of the AI, right? So from a patient perspective, having access to all your data in a single place actually leads to more efficient and personalized care, and actually makes that care coordination far more efficient, right? So what it does is it allows you to reduce the unnecessary duplication of tests, which is not only time consuming, but it's also costly, right? I mean, for me personally, it's helped me a lot in managing my own care among different specialists. So for example, I was feeling incredibly exhausted, and I really wasn't sure why I was feeling incredibly exhausted, right? I mean, it could be because, okay, I have a startup and I don't get enough sleep. It could be from the medication I'm on. It could be from the autoimmune disorder that I have. So I'm not really sure what was causing me to be incredibly exhausted, but I know that I had an iron deficiency in the past. And what I had done was I actually had uploaded all my information on Jonda Health. And that basically, I had a huge stack of papers and I had a whole bunch of PDFs. And all I needed to do was upload the PDFs, take the photos, upload them all onto Jonda. And what the AIs did was they took these documents that I uploaded and they categorized them using an AI module, so it automatically knew what they were. And then for the blood test in particular, what it did was it took that unstructured data and it structured it and standardized it so that all my biomarkers were nicely plotted in a time series graph. So when I checked my application to see what was happening with my iron, I had this really beautiful graph that showed this wonderful trend down. And so clearly my iron levels were on its way down. So all I really needed to do was when I went to the rheumatologist, I could ask her for my iron studies to please be added because I saw the trend going down. And she did. And I was right. My iron was incredibly low. And so I was able to then share that information with the general practitioner. And she was able to then say, oh, actually, you actually do need to have iron infusions. And so I was able to arrange that quite seamlessly via email by sharing all that data with my healthcare provider. So yeah, I mean, it definitely makes care coordination a hell of a lot easier for the patient. So yes, I thought I'd share one of my personal experiences as to how it really helps. Our aim to contribute to the healthcare community at large is really unlocking access to data. I mean, we really aim to improve care coordination, improve health outcomes, and facilitate research to advance modern medicine, all at the same time while preserving patient self-sovereignty, because for us that's incredibly important. And everything we do when it comes to design is really making sure that everything is as easy as possible to use for whichever stakeholder that is, particularly the patient, because when you have a chronic condition or when you're not feeling well, the last thing you want to do is worry about your health information, where it is. It really, everything should be easy and literally on your phone, and you should find anything, anytime, anywhere, when you need it, when you want it.